because she's so much higher than me, but it's all gonna work. Okay, so on your handout, guys, it says MCL and LCL stress tests. We're gonna start with the valgus and varus stress. You're gonna do these on each other. Please ask your partner if they have an issue with their knee, and don't use that knee if there's an issue. And you don't really need to, you're just gonna relax, right? Accurate assessment. And I would have her take her shoe off for the sake of time. Okay, just relax. Okay, they have to be relaxed, just like with passive range of motion, otherwise you're not gonna get an accurate assessment. I am stabilizing her joint line laterally, and I'm going to take her tibia and I'm gonna put it under a valgus stress, just like Charles did with my knee model. Except he was doing a varus stress. All right, so you got 30 degrees flexion and full extension. Do you see that? So here, I could tuck her in here. I could even have her open up, but I could have her resting her leg here and using the table while I'm stabilizing. Do you guys, can you picture that? And I think that's in your video, I mean on your handout. I don't see a picture of this. But anyway, valgus, valgus. Assessing what structure?
MCL.
The MCL. When it's flexed, you're doing just MCL. When it's extended, that's when you're going to get the insertion of the medial meniscus, the deeper fibers that insert on the medial meniscus. And if you have laxity on that, then there's issues going on. That's a bad one. Okay, opposite. So just relax, I'm sorry. So opposite here, LCL is varus stress, full extension. Boom, boom. Like the model. Okay, full extension, and if there's laxity, then you got to assume that the head of the fibula might be fractured. So you always are palpating to rule that out also. Okay, so that's number 1 is your valgus and varus stress tests. Okay, number 2 is ACL tests, which the first one is Lockman's, and you guys will see this any given Sunday when the knee's injured out on the field. You'll see the sports medicine professionals performing a valgus stress, assessing the integrity of the ACL. So what I'm doing, I'm making sure hamstring tendons are relaxed, because the hamstring tendons are going to hold on to the tibia and prevent that anterior translation. And I'm right under the tibial plateau here. Can you guys see this? And I'm going bam, bam, bam. No looseness. If this is ruptured, it goes, and it's like not good at all.
How?
Yeah, I was curious.
Okay, so that's Lockman's. The next one is anterior drawer, and you have images down here for this one, anterior and posterior. So what I'm going to do here is stabilize her foot, so I would have her lower, and now I'm pulling this way. And again, you don't want to see that open up or slide forward. So you guys remember the anterior drawer for the anterior talofibular ligament. Now you have a different anterior drawer for the anterior cruciate ligament. Okay, you can also do a posterior drawer. So now I'm on PCL stress tests. PCL, posterior drawer, we're going to have the knee flexed to 90 degrees, so boom, boom. And we're going to put, instead of pulling forward, we're pulling, relax, we're pushing. Okay, a better assessment of this is the Godfrey test, which is number 2. And what we're going to do here is take both legs and do what's called a 90-90 sign. Oh, just relax, please. I gotcha. I know it's weird. 90-90 sign, looking at the tibial tuberosity. So from a lateral view, if there was posterior cruciate ligament damage, then, and you could also look here as well with the tibial tuberosity, you would see the tibial tuberosity depressed or inferior to the other one. Sometimes ACL injuries sometimes PCL injuries present themselves as ACL injuries, and so these are ways to know which one is the real deal. Okay, medial and lateral meniscus. Again, this is going to be awkward with her shoes on, but this is the pictures on the top of page the last page, page 4 or whatever it is. And this one, I'm going to stabilize her calcaneus. So I'm holding on to her calcaneus. I'm going to take her into flexion. This leg's going to be straight. I'm going to take her into flexion and I'm going to rotate. So here I am compressing the menisci. To get the medial meniscus, I'm going to rotate and twist and take her into a valgus stress. Did you guys see this? So I'm here and I'm going out and down. And then you also do the opposite for varus stress. You okay? Okay. All right, and then we got Apley's compression. Okay, I'm not going to have her do this, but she would roll over on her belly, be flexed to 90 degrees, and I'm going to push down on her calcaneus and rotate like this. That's compression. And then patellar stress test. Okay, this is another one I'm not going to do, but I'm going to demonstrate it. So for this one, don't do this. I'm just going to talk about it. Okay, I'm going to push down on her patella. And do you guys remember I said that everyone has some articular cartilage issues going on? Okay, well this is why we're not doing this, because it really hurts everybody when you do this. But push down here, have them contract. This is called Clark sign, or